Well, I'm Katie Fick, and I'm volunteering full-time with the Lutheran Volunteer Corps, so I live next door at the Dorothy Day House. And my placement is Bread of Healing Clinic, which is about 2.5 miles to our east. And that placement has given me a chance to see healthcare and especially the brokenness in the healthcare system from an interesting perspective this year. I've begun to realize both how huge and how all-encompassing the gaps in the healthcare system are, and how quickly those gaps continue to grow. An estimated 100,000 people are uninsured in Milwaukee, and that amounts to about 12.5%, or 1 in 8 people. That doesn't even count the people who are underinsured, programs like Medicaid and Badger Care. Those are something, but they still make somebody uninsured, or underinsured, excuse me. There are options for people without health insurance. Some of those are FQHCs, federally qualified health centers, like some of you may know MLK or Isaac Cogs, or Westside, or the 16th Street Clinic, or Healthcare for the Homeless. Those are all FQHCs, and they see about 25,000 uninsured patients every year. They also charge $20 usually as a minimum for each visit, which for a lot of people is not feasible. So other options are free clinics like Bread of Healing Clinic where I work. Some of you may have heard of some of the other ones, like St. Ben's is really large, City on a Hill is really huge and amazing. Charles Mason, that one I'm not too familiar with, or just chronic disease clinics around Milwaukee. And then, kind of contrary to some popular belief, the ER is not really an option. Dr. Barbara Horner-Eibler, who's the medical director at Bread of Healing, reminded me that they are not required to treat everybody, especially if someone isn't going to die that night, that day, or the following day. They are not, they're probably not going to see a person. 2000, the Bread of Healing Clinic started with just my supervisor, who's an RN. He was working at the emergency department at Sinai, and started noticing how many people were being forced to use that facility as a sort of primary care place to go for what are kind of outpatient procedures like suture removal and things like that. But they didn't have anywhere else to go. That was one of the only places that would accept them without medical insurance. And so he met Dr. Barbara Horner-Eibler around the same time, and she has her MDiv, her MSW, and she's a medical director. So you can imagine that together they're a pretty unstoppable team. And they both have a passion for working to help fill in the gaps in the healthcare system. And both of them at the same time were noticing some of the same types of problems and brokenness in the system. About 10 years to today, and Bread of Healing is working to remove barriers of all kinds in the healthcare system. They're one of 3 sites now, the other 2 being at Eastbrook Church and Agape Community Center. And there are countless doctors, nurses, specialists, residents that come in and out and rotate through, med students who do like a 5 or 6 week cycle in the clinic, a pharmacist, a veteran pharmacist, physical therapy, nutrition specialist, and dozens of other support kind of staff volunteers that help the clinic run. We couldn't do it without those people either. To give you a little rundown of Bread of Healing, all 3 sites of Bread of Healing together they see now about 1,300 to 1,500 patients in about 3,000 or more patient visits in a year. So today it's more or less at capacity. The capacity continues to grow, and one of the cool things about the Free and Community Clinic Collaborative is that they were just able to hire 3, I think, almost part-time people. Capacity is growing, and that's a sign that more grants are being written and more money is coming in
more people are getting involved. But I mean, all that said, I still have to say, no, I'm sorry, we can't take any more new patients, to about 5 people every day, whether it's on the phone, returning a voicemail, or being approached in person by someone who doesn't have any place to go or doesn't have anywhere that will take their insurance. They're all over the board. Some people have diabetes. Actually, about 40% of our patients have diabetes, 60% have hypertension, and 22% have asthma. But one thing is usually the same, and that's just that the broken healthcare system has let them fall through its numerous and large cracks, and they don't feel they have any place to go. These days, when we talk about the new legislature at the clinic, everyone's heart sort of falls, because we don't even really want to talk about it that much, because it's so scary to think about. Even just me turning away 5 people, that's not including any of the other volunteers that work at the clinic. That could increase to 10, 20, 30, 40 people a day that I have to say, no, I'm sorry, we can't see any new patients. So, I try to remember that we're not the only place that can help, and be thankful for that, but there are about to be a lot more uninsured people, even than there are right now, which is just insane, really, to think about. So, despite that haunting thought, what I want to leave you with here today is just that there are places and people in Milwaukee that care, and I'm, in awe every time I look at my boss, Rick Caesar, or Dr. Barbara Warner-Eibler, and think about how much they're doing and how huge their hearts are, and how it doesn't seem that their hearts can grow anymore, and then they do, and it just boggles my mind. So that is one thing that helps me sleep at night, and those people are working to help those who fall in the cracks, and they'll continue to pick up the pieces when there are even more people that are falling in those gaps.